Hello again. I'm Dr. Mark Poray, a sports and family chiropractor in Brooklin, Ontario. Now, before I graduated from the Canadian Memorial Chiropractic College in 1985, I competed in several marathons and had been a collegiate swimmer competing in the national championships in 1970. After becoming a chiropractor, I kind of naturally moved into triathlon as a competitor, winning a few age group races. I became involved in the medical teams for triathlons and was the medical director for the Ontario Triathlon Association for 2 years. Now, while I no longer compete, I still treat many triathletes, and one of the things I try to tell them is that cross-training is especially important. One of the reasons cross-training is to give parts of your body a rest while others continue to train. Another reason is to give your mind a rest while you do something similar to continue to train appropriate muscle groups. When it comes to the cycling portion of triathlon, there are a number of great cross-training activities like skating, rollerblading, cross-country skiing, but obviously the closer your cross-training sport is to your actual road biking, the better. So mountain biking is the sport I generally recommend. Now, the great thing about mountain biking as a sport is that while the cycling itself uses the same muscles as road biking, it also uses an awful lot of upper body muscles, which makes it complementary to swimming as well. So let's discuss some of the primary muscle used in mountain biking. First of all, the biceps are important because they are used to throw the bike around on trails and to steer and stabilize in those tough corners. This is not quite as important in road biking because the riding there is mainly in straight lines on smooth roads. Now, the abdominals are used as a pressure regulator in uphill climbs and also to pull the pedals up to lift the bike over obstacles. The gluteus maximus, the big muscle behind you, is important in pushing down on the pedals or extending the hips. They also stabilize the hips. Now, the same is true of road biking. The hamstrings, more specifically the semitendinosus, aid the gluteal muscles, which extends the hip on the downstroke while the hamstrings flex the knee on the upstroke of the pedaling. Another pelvic stabilizer is the hip flexor, or the psoas, which lies deep inside the core and pulls the thigh upwards. The quadriceps and the iliotibial band are also extremely important in cycling. Finally, the gastrocnemius, or the calf muscle, is very crucial because its job is to extend the ankle by pushing the toes down. Because your forefoot is locked into the pedal, this muscle is important in the downstroke of cycling. There are also other muscles that need to be addressed to be successful in mountain and road cycling. But what I want to address is low back pain in mountain biking. That's the main core of today's talk. Why does it happen? Who are the culprits? What can be done to prevent it? And how do you fix it when it does occur? If you cycle a lot, you will have low back pain. So first of all, why does it happen? Most of us don't do anything special to train for mountain biking. It seems to be an exercise in itself, and we use the riding as our fitness program. In fact, this seems to be a general philosophy that was cultivated many years ago, kind of the play hockey to get in shape for hockey mentality. Now, if we look at cycling, we begin to see why this is a bad idea. In cycling, we tend to sit as much as possible, using the advanced gearing on the bikes to assist us both uphill and down. In the seated position, the large muscles of the low back are stretched and are never really properly utilized. The muscles at the front of the hips, the hip flexors or the psoas muscle, are constantly working and tightening. So we create a situation where the muscles at the front of the hips become tight and the muscles of the low back become looser and weaker. Tight hip flexors without balanced hip extensors will encourage low back pain, mainly after riding, but eventually it'll become all the time. So our culprits are not necessarily weak back extensors and tight hip flexors, but rather an unbalanced strength which favors the hip flexors. Now, how do we fix this? The important thing is to understand this and consider doing some specific conditioning to reverse it. First, we need to incorporate some hip flexor stretches and low back strengthening. To stretch, you can try a static lunge, alternating each leg for about 30 to 40 seconds. To strengthen the low back, try prone position, alternate leg raises, or prone back extensions. Balancing exercises on a half ball is another possible way to balance your core. These are ways to improve your hip mobility. The next thing to do is to spend more time out of the saddle while you're cycling. This is something that you can address going both uphill and down. This will help to alleviate much of your back pain, as well as making you faster on the trails. Getting out of the saddle more is also a recommendation for road cycling. In road cycling, you spend even more time in this hip flexed position. So faulty movement patterns on the bike waste energy as well as causing low back pain. Changing them will decrease your back pain, increase your speed, correcting your biomechanics, and add to your endurance by saving you potential energy. To get rid of the back pain, it's simple. It's important that you get advice and treatment from your sports chiropractor so you get back to enjoying your favorite trails. I'm Dr. Mark Poray. I hope this helps you. You can find more video blogs about other health issues by scrolling through the archives on my website at www.drporay.com. You will also find directions to our clinics as well as my hours. Happy trails!